Do you know your current blood pressure levels? It's a figure that many might not keep at the forefront of their minds, yet it plays a critical role in overall health and well-being. Blood pressure is the force exerted by circulating blood on the walls of the body's arteries, and it is one of the vital signs used to measure physical health. High blood pressure, also known as hypertension, often has no symptoms, but can lead to serious health issues, including heart disease, stroke, and kidney failure. Understanding your blood numbers is essential. These numbers reflect the systolic pressure, which is the pressure when the heart beats and pumps blood, and the diastolic pressure, which is the pressure when the heart is at rest between beats. A normal blood pressure reading is typically around 120/80ths mmHg. However, if these numbers rise consistently above 130 for systolic or above 80 for diastolic, it's considered a condition of high blood pressure. High blood pressure can stealthily damage your body for years before symptoms develop. Without detection, it can cause the walls of your arteries to get overstretched and damaged, leading to a buildup of plaque that can restrict blood flow. This condition can also strain and damage your heart, leading to cardiovascular diseases. It's often labeled the silent killer because it doesn't usually cause noticeable symptoms until significant damage has been done. The reasons for high blood pressure can vary. It can be influenced by genetic factors, age, diet, physical activity levels, and even stress. Eating a diet high in salt, fat, and/or cholesterol is particularly problematic. Being overweight or obese increases your risk significantly. Regular physical activity can help reduce this risk and manage your blood pressure effectively. Preventing high blood pressure is crucial and possible with lifestyle changes. Maintaining a healthy weight, engaging in regular physical exercise, eating a balanced diet low in sodium and rich in fruits and vegetables, and limiting alcohol intake are all effective strategies. Regular blood pressure checks are also vital, as they allow for early detection and management of changes in your blood pressure before they escalate into more severe conditions. Today, as we delve deeper into the implications of high blood pressure and explore strategies for management and prevention, remember this is more than just numbers. It's about understanding and taking control of your health for a better quality of life. We will explore different methods to keep blood pressure within a healthy range and discuss the importance of regular health screenings with your doctor. By arming ourselves with knowledge and commitment to healthful practices, we can combat this quiet threat. Let's educate ourselves about this subtle yet potent risk to our health and learn how to manage or prevent this stealthy health adversary. High blood pressure, also known as hypertension, sneaks up without noticeable symptoms. Often dubbed the silent killer, this condition quietly undermines health, frequently presenting with few or no warning signs. Hypertension occurs when the force of blood against the walls of your arteries remains high over a prolonged period. This persistent high pressure is concerning because it forces the heart to work harder than normal, which can gradually weaken it and lead to a host of cardiac problems. Imagine the intricate network of arteries in your body as highways through which blood travels. These highways need to maintain just the right pressure to ensure that blood reaches every part of your body, from your brain to your toes. Normal arterial pressure ensures that this process runs smoothly, much like cars on a well-maintained highway. However, when the pressure in your arteries is too high, it's like a traffic jam that causes delays and accidents. In bodily terms, this means potential heart attacks, strokes, and organ damage. Understanding hypertension requires knowledge of its risk factors and implications. The risk factors for developing high blood pressure include genetics, poor diet, lack of exercise, and excessive salt intake, among others. Age also plays a crucial role. As we grow older, the risk of hypertension increases due to natural changes in blood vessel elasticity. Lifestyle choices such as smoking and alcohol consumption can further exacerbate this condition. To fully grasp the gravity of hypertension, consider that it affects nearly 1 billion people worldwide. The condition is not discriminatory. Men and women, young and old, the wealthy and the less affluent are all affected. Despite its prevalence, many remain unaware of their condition until it becomes severe, often resulting in catastrophic health issues. It is crucial to regularly monitor blood pressure levels. particularly if you are in a high-risk category. Preventative measures include adopting a healthier lifestyle, eating a balanced diet, exercising, reducing sodium intake, and avoiding harmful substances. Medical intervention often involves antihypertensive medications, which help manage blood pressure effectively when lifestyle changes alone are insufficient. The narrative of hypertension is not just a medical issue, but a societal one. It underscores the need for greater awareness and preventative measures at all levels of society. Public health campaigns, regular screenings, and education about hypertension can lead to significant improvements in community health. When this pressure remains high over time, it stresses the heart and damages various body organs. So what causes high blood pressure? Factors range from genetics to lifestyle choices. The story of hypertension involves a complex interplay of various elements that can tip the scales towards this common yet dangerous condition. One of the primary factors is diet. An unhealthy diet, particularly rich in sodium, fats, and processed foods, can significantly increase blood pressure. Excessive salt intake, for instance, causes the body to retain more fluid, which puts additional strain on the heart as it works to pump blood through the vessels. High levels of unhealthy fats contribute to the buildup of fatty deposits inside the arterial walls. This accumulation narrows the arteries, reducing the space for blood to flow and thereby increasing the pressure in the vessels. Processed foods, which are often high in both salt and fats, further compound the risk associated with poor dietary choices. Yet, diet is but one piece of the puzzle. Another significant factor is physical inactivity. A sedentary lifestyle results in weaker heart muscles, which then need to exert more effort to circulate blood. This added strain can naturally lead to higher blood pressure over time. Excessive alcohol consumption and tobacco use also play direct and detrimental roles in elevating blood pressure. Alcohol disrupts the natural rhythm of the heart and weakens the walls of blood vessels, while the chemicals in tobacco smoke inflame the blood vessel linings. This inflammation causes the vessels to narrow and stiffen, further impeding blood flow and increasing blood pressure. Moreover, stress significantly influences blood pressure regulation. Chronic stress stimulates the body's nervous system, leading to an increased production of hormones that elevate heart rate and constrict blood vessels, which in turn causes spikes in blood pressure. Certain chronic conditions also increase the likelihood of developing hypertension. For instance, diabetes leads to arterial damage and increased susceptibility to artery hardening, a frequent contributor to high blood pressure. Obesity plays a role too, as it increases the volume of blood the heart needs to pump, which naturally raises blood pressure. All these factors, from genetic predispositions to personal and lifestyle choices, interconnect to influence the risk and severity of hypertension. Not to forget, stress and certain chronic conditions such as diabetes and obesity are linked with higher risks of developing hypertension. Managing high blood pressure involves various strategies. Incorporating a heart-healthy diet rich in fruits, vegetables, and whole grains can make a substantial difference. Engaging in regular physical activity such as brisk walking or cycling is also instrumental in managing hypertension. These activities aid in maintaining cardiovascular health and thus lower blood pressure. Additionally, it is important to limit salt intake and reduce alcohol consumption. Avoiding smoking altogether can significantly benefit overall health. These lifestyle modifications, coupled with regular health checks, can drastically improve life quality. Regular monitoring of blood pressure helps in identifying potential health issues early, allowing for timely medical intervention. Medication may also play a role in managing high blood pressure, especially in cases where lifestyle changes alone aren't sufficient. There are various classes of drugs used to treat this condition, each targeting a different aspect of cardiovascular health. For example, diuretics help reduce blood volume through increased urination. Beta blockers lower blood pressure by decreasing the heart rate and the force of each heartbeat. ACE inhibitors relax blood vessels by preventing the formation of a hormone that causes vasoconstriction. Calcium channel blockers also aid in relaxing the blood vessel walls, as well as decreasing the heart rate. Each medication type comes with its own set of potential side effects and interactions, which is why it's crucial to manage these prescriptions under the guidance of a healthcare professional. Medications work in different ways to lower blood pressure by relaxing blood vessels, reducing heart rate, or reducing the volume of blood. In conclusion, high blood pressure might be a common condition, but it's one that you can often control through lifestyle adjustments and proper medical care. Adopting a balanced diet, Staying active and keeping a healthy weight are vital. Avoid smoking and excessive alcohol to lower risks. Regular screenings are crucial to detect and manage hypertension early. Remember, the best way to fight high blood pressure is to catch it before it becomes a problem, so regular checkups are essential. Keep an eye on your blood pressure. It could be the key to a longer, healthier life.